So I see a lot of people with autoimmunity in my clinic. It's a very common, especially because there are so many types of autoimmune condition. They're kind of all lumped into this one, big category. So I thought I'd talk about it because it is so common. So there are three kind of prerequisites, I guess you would call them, in order to develop autoimmunity, full-blown autoimmunity that can be measured, either in scans or blood tests. The first one is a genetic predisposition, and that predisposition is different depending on the condition, but there is generally a hereditary component. Then there will be an environmental trigger, again, varied. It could be an infection, it could be a toxic exposure, it could be chemicals or food sensitivities, but something, external that triggers a response in the body. And then also leaky gut, or called, more formally called intestinal permeability. And the thing about leaky gut is it's not just the leak, it's not really the leakiness of the gut that is, directly that's the problem. It's the immune dysregulation that it causes. So hopefully you've all already heard of leaky gut. It's basically, when undigested food particles, sometimes even infections, just anything that's going through the gut can actually leak out into the bloodstream because of, the cells or the moving apart and creating bigger areas to move into the bloodstream. And so, undigested food particles go through there and they cause an inflammatory response, or this immune dysregulation that I mentioned. Now, what causes leaky gut? Again, it's a huge list. One of the big ones is inflammatory foods. It could also be long-term use of medications. It can be other lifestyle factors like poor sleep, high stress, you name it, it can cause leaky gut. Okay, so these are the three things that are required to kind of develop autoimmunity. Now, what happens a lot of the time is that it goes unchecked. So people are kind of they develop the leaky gut, they have a trigger, they may even be slightly symptomatic and have some mild symptoms. A lot of people will mistake this for age. I have a lot of clients come to me and say, I just thought I was getting older, I was really tired, I was starting to get a bit achy, and I just thought I was getting old. But actually, it's the autoimmune process, progressing. And what happens in this progression is that you start with this kind of, chronic inflammation, as I said, from foods or toxins or sleep deprivation, whatever it is, and you have the leaky gut and the gene. And if left unchecked, it kind of progresses to an overwhelmed immune system because, you've just got this chronic inflammation and immune response just consistently happening and taking up energy. Then it becomes actual dysfunction. And this is where the body starts to have trouble kind of recognizing or distinguishing self from non-self, and starts, this initial attack of something, some organ in the body, with sometimes it can be the thyroid, it can be joints, it can be other organs. Okay. So, and then you get full-blown autoimmunity if it kind of continues down that path.